A very warm welcome to everyone. Thank you for joining today's session. I hope I'm audible.
Yeah, you are audible, Connie.
Yes, thank you. Thank you for confirming, Pallavi. So today's guest speaker is Dr. YP Bhatia. A very warm welcome to you, Doctor.
Thank you so much. Thank you.
Yes. So to introduce Doctor has all over 40 years of experience. He is the managing director of Astron. Along with that, Doctor has closely worked with the hospitals and have 70 health organizations. He has designed and planned 70 health organizations in India. So probably to just give an idea why we are hosting the session today is that Astron and InspireIMG have collaborated together to provide courses to all of you, which is very much helpful for the doctors along with the education. So, Doctor, you can take over the session from here.
Yeah. Thank you so much for the kind introduction. Good morning, good afternoon, ladies and gentlemen and friends. It's a great opportunity to, interact with the fellow professionals and colleagues on the topics which are so contemporary and so, much issue-based right now. I want to be very candid in, how I put this across. That when we people pass out of medical schools and get into the actual practice of operations, or otherwise also those of my colleagues who work in healthcare quality and they've done their MBAs and PG diplomas and all that, when we are actually put into the real-time operations, whatever training we have done, of course, is the basis of what we are going to practice. But are we ready to practice that? Are we in a position? I remember of my days, when I started my first day of internship, and I had a patient, who came up in the emergency. I knew that the patient has got something wrong. There's a rigidity, the neck rigidity is there, the fever is there, the findings are there. But for me to, kind of reach a conclusive diagnosis that I'm dealing with a case of meningitis, I wasn't very sure, I was very shaky in reaching that this thought process and start the decision making. Same way a patient lands up with a pain which is epigastrium or a chest pain or something like that. I'm trying to distinguish, whether it's a abdominal discomfort or a chest pain or something. I am not equipped for that. The third factor that we are talking about is, that over a period of last 3 to 4 decades that I have been into practice, the healthcare technology is like moving so fast. It's like the pace of upliftment, upgradation of technology is even faster than the time you take to spell the word technology. I've been associated with the cancer centers in a very big way. Having established Rajiv Gandhi Cancer Institute, I had my MBA training at the Fred Hutchinson Cancer Institute in Seattle. And after that, established many cancer hospital, cancer centers. Just the linear accelerator that we are talking about, radiation equipment, probably has undergone a transformation more than 18 times in last 30 years. CT scan, simple CT scan, which used to be just this thing from CT scan to spiral, and in spiral, from 2 slice to 6 slice to 16 slice to 64 slice, and today 256 slice, and further we are talking of upgradation of the equipment. How fast the technology is changing. And the third factor which we talk of, change on disease profile, the way it is happening. Who could expect a COVID to come up and shake up the whole world? Were we equipped to that? Were we ready for that kind of situation? And will that not situation come again and again and again? In fact, with now, the advancing methodologies of artificial intelligence and robotics and, automation, you talk of the thing, and every day we are coming with something which is entirely what we could not anticipate. Genetically engineered drugs, and, while we were students and while we were initial practitioners of medicine, we always thought this to be science fiction. We always thought that this will happen. Yes, but probably the next generation will see that. We didn't realize that all this will come in the present generation. And while it's coming in the present generation, many of them will be ill-equipped, forget about handling it, to be even aware about it. It is something like, when the era of computers came in 90s, our generation, we had never known what computers could be. In my earlier time, early 80s, I saw a computer center at Air Force Station Ambala, and that was, the computer itself was housed in something like a 500 yards piece of land, a big area which was just a computer. And now, you have your computer even in your watch. And we had to learn it if we had to survive. When I started my career as a hospital administrator, there were no computers. But while I was managing the first hospital of my career, the computers started coming in. And by the time I finished my 5-year tenure in that institution, we realized and we knew that we cannot live without computers. And I had to learn it. There was no way that I don't learn it. I had to learn that. So today's session that we are talking about is the upskilling of skills, an imperative. And I would request Polmi if you could share the presentation, and we'll take it from there forwards. So today's discussion, we have put a flow that I've already initiated about the situation, current situation and the problem. We'll, go with the fact sheet. We'll, share with the data and what we have the suggestions on this, and ultimately call to action and takeaways. Of course, I'll end with, when you all are looking into it, how you implement in your own professional and personal life. So we'll end on that. So next slide, Paul. Yeah, so, as I have been mentioning, that demand for skilled healthcare force is currently on the rise. Now, there are multiple factors. Population growth is one, aging is one, changing epidemiology is other one, the NCD's prevalence is one. But I think what is more important than all this that we have put together is the changing healthcare behavior. What you see that the overall health-seeking behavior of the population at large has changed. If you go back 2 decades, a lot of people will treat themselves. They would not go to hospital. The early detection of symptoms, early detection of diseases was at a backseat, more so in the women and the children. Now, people are taking interest in their own health. People are seeking consultation for what they need to do. People are wanting to go ahead, and if you look at the per capita expenditure, look at the insurance companies coming up in the healthcare field, the way they are slowly getting into the market, the way the national programs, Ayushman Bharat, the various NHS schemes, the state-sponsored scheme, they all are coming up. And with that, there's an exponential rise of number of healthcare institutions in the country. We had only about 100 medical colleges in the country, and we are talking of today about more than 600 medical colleges in the country. Each medical college comes up with the 750 to 1250 bed hospital. Similarly, you go to earlier, the growth of healthcare facilities were happening only the metro towns and the tier 1 cities. Today, tier 2 cities, tier 3 cities, they are all developing their own hospital. We have the buildings, we have the equipment coming in, but each institution requires skilled healthcare. Are we equipped to have that? Even while we may be having the basic numbers, but are they equipped to handle what they are required to handle? I was just reading somewhere in Haryana, state of Haryana, the medical colleges, they are staffed to only 49%, 51% efficiency. In the AIIMS-like institutions which have been created in the country, the deficiency ranges from 74% to 48% or 34. So 48, 74 to 38%. Those are the numbers. But beyond the numbers, there is a situation when the skill gap creates hurdles in people performing what they're required to perform. So I've just mentioned about the numbers, but if we are talking about skill gap, I think these numbers will become much more. This is where the requirement has come in. In fact, today the gap is widening day by day because healthcare institutions are coming up. Healthcare institutions are moving forward. The number of healthcare institutions which are coming up on yearly basis